بسم الله الرحمن الرحيم. أبنائي الأعزاء، السلام عليكم ورحمة الله وبركاته. رمضان كريم وصيام مقبول. أرحب بكم في المحاضرة الأخيرة لموضوع Disease of the Pharynx. اليوم نختم إن شاء الله موضوع الفارنكس، وخاتمتها راح تكون على موضوع التيومرز. يعني هذا السبع يقول لكم السلام عليكم. Tumors of the pharynx are either benign or malignant, and they affect any of the three parts or regions of the pharynx, اللي هي nasopharynx, oropharynx or hypopharynx. There are some general features in sharing all of the pharyngeal tumors. They are almost always malignant, and squamous cell carcinoma is the commonest malignant tumor affecting the pharynx in all of these departments of the pharynx. Local regional spread is the commonest mode of spread. When we said local regional, it means local يعني local site of growth. Regional معناها lymph node، بمعناها the metastasis of the disease or the tumor from the primary site into the regional lymph node. This is the commonest way of spread of these tumors. Radiotherapy, and nowadays we are talking about chemoradiotherapy because we combine the two forms of treatment of malignancies to increase the responsiveness of the tumor to treatment. Is the commonest mode of treatment. Surgery is of limited role because of the anatomic difficulty of the pharyngeal compartments, but still the biopsy is a universal surgical procedures. The first site we are going to study is the nasopharyngeal nasopharynx and nasopharyngeal cancer. And in nasopharyngeal cancer, carcinoma is the commonest malignant tumor of the nasopharynx, and squamous cell carcinoma is the commonest malignancy affecting the nasopharynx. There are other malignant tumors, اللي هي lymphoma, adenocarcinoma, and sarcomas in general. Epidemiology of nasopharyngeal carcinoma. The disease is common in Mongoloid race, اللي هو Southeast Asia people, as China, Singapore, Taiwan. هاي صورة يعني تطلق واحد من اللي هم المونغولويد race in Asia. Male is predominant with a ratio of 3:1, and the age of affection is usually the 5th and 6th decades of age, اللي هو middle age people, but young adults are not excluded, and this is called bimodal distribution. Here we see that there are two peaks in tumor growth, the young and the middle age people. طبعا the most common is the middle age people. The disease is HLA related. It means that there is a genetic predisposition for the disease development. There are high titers of Epstein-Barr virus, and this refers to the role of virus in the initiation of pathogenesis of the disease. Common site of origin is the fossa of Rosenmiller. What is the fossa of Rosenmiller? Here is the lateral wall of the nasopharynx. You see, this is the nasal cavity. These are the three turbinates. So this is the lateral wall of the nose. If we go back, we'll see the lateral wall of the nasopharynx. This is the Stachan tube opening. This is the Stachan cushion, the prominence around the Stachan tube. Behind this is the fossa of Rosenmiller. It's a common site for the growth of nasopharyngeal tumor, as in this picture. Pathological presentation of the tumor. Grossly, there are three pictures: either proliferative picture بمعنى mass, ulcerative picture, والinfiltrative picture اللي هي thickening, submucosal infiltration of the tumor cells. Histologically, the WHO's classification of the tumor is number 1, keratinizing squamous cell carcinoma, and is the commonest histologic pattern of nasopharyngeal carcinoma. Non-keratinizing, well, undifferentiated type. Etiologically speaking, the tumor is often, still the exact etiology is not known, but there are factors involved in the pathogenesis of the tumor: genetic, environmental, وviral. يعني environmental معنى الكارسينوجينز. Viral is one of the carcinogenic effect on tumor development. Clinically, the tumor may present in 60% of cases with neck swelling, and the neck swelling is mostly related to cervical lymphadenopathy. The common lymph node group affected هي الأبر deep cervical lymph node اللي عادة موجودة بين الماستويد process وبين الانجل of mandible، و lymph nodes of posterior triangle. هذه هي sites of lymph node affection. Second feature هي autologic manifestation or autologic features اللي تشكل 20% of cases, and deafness and pain, otalgia, are two common presentations, autological presentation of nasopharyngeal carcinoma. طبعا deafness is due to the middle ear effusion, بنسميه otitis media diffusion. بمعنى there is some fluid inside the middle ear behind the tympanic membrane, and this fluid is filled with malignant cells. So any adult patient with unilateral persistent otitis media diffusion nasopharyngeal carcinoma should be excluded. Rhinologic features in 10% of cases واللي تشمل unilateral epistaxis and nasal obstruction. Again, any adult middle-aged patient presented with persistent unilateral nasal obstruction and bloody nasal discharge, nasopharyngeal carcinoma again is one of the differential diagnoses, is in the list of the differential diagnoses. Other clinical features اللي هي neuro-ophthalmological features اللي تشكل 10% of cases، والneuro-ophthalmologic هي cranial nerve affection، وcommonly هي fifth و sixth cranial nerves اللي هم are closely related to the anatomy of the nasopharynx. وهذا facial pain that the patient is complaining is due to the affection of the trigeminal nerve. والabducent pulse اللي يصير with nasopharyngeal carcinoma is due to the affection of abducent nerve. In the advanced stage of the disease, the glossopharyngeal and the vagus are affected. في حين إنه eye symptoms هي diplopia والproptosis. For diagnosis, the diagnosis is based on history, clinical examination, radiologic examination, and histopathologic diagnosis. In clinical examination, the aim of the clinical examination is to see the nasopharynx, to see the pathology in the nasopharynx. Anterior endoscopy is not helpful because everything might be normal. Posterior endoscopy is of limited role because only in large exophytic tumors we could maybe seen by the posterior endoscopy mirror, while small oral ulcerative tumors could not be seen. Today, endoscopic examination is used to see either there is a mass in the nasopharynx, and commonly the patient presents with obstructive symptoms, either nasal obstruction or Stachyn tube obstruction. Ulcerative pathology اللي ينطينا عادة epistaxis، والinfiltrative pathology اللي ينطينا neuro-ophthalmologic manifestation. Endoscope, either we use the fiber optic endoscope or the rigid endoscope. Both they help to establish the clinical suspicion and may be used to take a biopsy. See here, هذا هنا, this is the growth, this is the mass of the tumor by the endoscope, this is the mass of the tumor by endoscope. طبعا keep in mind that the diagnosis of nasopharyngeal carcinoma is usually late because the tumor may remain silent for a certain period of time, لأنه the early manifestation may be similar to other inflammatory conditions in the nasopharynx. In imaging studies, plain X-ray will show the presence of mass in the post-nasal space. Other pathologies could not be detected. CT scan will show the tumor and its extension. The MRI study might be used to detect intracranial or intraorbital extensions of the tumor. Biopsy is essential to establish the clinical diagnosis and to grade the tumor. And here is the CT scan finding of nasopharyngeal carcinoma. So this is the mass affecting one side of the nasopharynx and eroding the pterygoid plate. The presence of mass with erosion of the pterygoid plate would increase the suspicion index of nasopharyngeal carcinoma. Treatment, we should thank God because the tumor is radiosensitive. Yani, lucky. That's why radiotherapy is the primary treatment modality of nasopharyngeal carcinoma. Surgery, يعني تاخذ شكل nasopharyngectomy, is very limited role is used because successful surgical excision is difficult. And then radiotherapy is the primary or the main line of treatment. وبالراديوثيرابي we should include the primary site اللي هو nasopharynx والneck, أقصد lymph node, even when the lymph node are not palpable, should be included in the radiotherapy program. Neck dissection is يعني هاي تخص lymph node is reserved for lymph nodes not controlled by radiotherapy, or those which are recurred after the first course of irradiation. In recurrent tumor, radiotherapy could be given as a second dose. And this is the only site of the body in which we could repeat the radiotherapy if the tumor recurred. These are some golden rules in nasopharyngeal carcinoma. Any persistent middle ear effusion of long duration in adult patient with no prior history of middle ear disease, suspicion for a tumor should be investigated accordingly. Any adult patient with severe epistaxis, nasopharynx should be examined. Any adult patient with metastatic neck lymph nodes, the nasopharynx should be examined for primary growth. Any adult patient with unilateral proptosis, again nasopharynx should be examined. One adult patient with a progressive nasal obstruction and bloody nasal discharge, all these features may call for examination of nasopharynx. The second site is the oropharynx, and in the oropharynx we have major sites in here: tonsil and its pillar, soft palate, base of tongue, and the posterior third of tongue, and posterior pharyngeal wall. Therefore, the tumor development according to the site of origin are in the lateral wall اللي تشمل الtonsil and its pillars in 45% of cases. In the floor اللي هو posterior third of tongue 40%. Posterior pharyngeal wall 10%, والpalate soft palate 5%. General histology of the tumor in the oropharynx. عندنا 3 histologic tissues or 3 types of histologic tissues in the oropharynx: the epithelium, the lymphoid, والminor salivary gland. Therefore, the tumors of the oropharynx, squamous cell carcinoma is the commonest, 75% of cases. Lymphoma 15, minor salivary gland 10%, lymphoepithelioma 5%. Generally speaking, carcinoma is nearly always ulcerated, while lymphoma and minor salivary gland tumors are presented with smooth enlargement. Always the neck should be examined or palpated to complete the examination. In lymphoma, the type is non-Hodgkin lymphoma of the B variety, B cell variety. T cell lymphoma is less frequent. Minor salivary gland tumors are commonly found in the soft palate, and nearly 50% of the tumors are malignant. Pathologically, gross appearance either exophytic, يعني enlargement of the site as a mass, ulcerative ممكن نشوفها على التونسل، ممكن نشوفها بالبوسيفرنجيال وول ألسر، ممكن نشوفها بالبيز اوف تانك. وانفلتراتيف هذا أكثر شيء نشوفها بالبيز اوف تانك. Histopathologic squamous cell carcinoma is the commonest. Lymphoma, lymphoepithelioma اللي هو one variety of squamous cell carcinoma والadenocarcinoma اللي هي minor salivary gland malignancies. Tonsillar carcinoma, the tumor may remain silent for some time. Dysphagia and adenophagia is a manifestation. Blood saliva is another feature. Fetid breath يعني اللي هو bad odor from the mouth, with voice change اللي هو muffled voice because of the mechanical effect of the mass of the tumor, neck mass يعني أكو lymph node involvement. Examination would reveal a unilateral tonsillar enlargement with a large cervical lymph node. هنا نشوف إنه the whole of the tonsil is enlarged as is crossing the midline to the opposite side. ولا أريد كل شيء يعني نشوف إنه السيرفس مالتها is multiple ulcerative surface. هذا unilateral enlargement it gets crossed the midline with the presence of a lymph node should raise the suspicion with age of the patient. So يعني malignancy should be excluded. CT scan and MRI to assess the tumor extension and invasion to the surroundings, and biopsy in the form of unilateral biopsy tonsillectomy is mandatory to establish the diagnosis. هنا نشوف إنه this is the growth and this is the lymph node which is affected. This is the cross هذا بالتونسل, and this is the group of lymph node هذه هي بالضبط which is affected. Treatment, radiotherapy is the mainstay of treatment. Chemotherapy has an adjuvant role to radiotherapy. هذا الكلام القديم. Nowadays they combine the chemoradiation to increase the tumor responsiveness. Surgery is of minor role, and usually surgery is a very destructive surgery. Okay? Tonsillar lymphoma, the oropharynx is a common site for extranodal lymphoma, اللي هي non-Hodgkin type, and is of B cell variety with high grade malignancy. The T cell non-Hodgkin lymphoma is less frequent. Clinical features: smooth unilateral enlargement of tonsil with cervical lymph node اللي هي tonsillar lymph node اللي هي jugular digastric lymph node. Biopsy tonsillectomy is helpful for histopathologic diagnosis, and radiotherapy is the main treatment line. نشوف إنه there is smooth unilateral enlargement of the tonsil in lymphoma. The third site for in the pharynx here are tumors of the hypopharynx, and again in the hypopharynx we have three major sites. Number one, Pyriform fossa. Number two, post-cricoid area, and number 3, posterior pharyngeal wall. 60% of tumors are found in the pyriform fossa. 30% in the postcricoid. Postcricoid يعني behind the pharynx. The larynx I mean. Posterior pharyngeal wall is يعني the posterior pharyngeal wall. So there are 3 anatomic sites اللي هي pyriform sinus, postcricoid area, posterior pharyngeal wall. Pathology of hypopharyngeal tumor. Pyriform fossa tumors are presented as a mass in the pyriform fossa, and 75% of patients will have lymph node metastasis. The tumors of the lateral wall of the pyriform fossa is presented as a neck mass. بحين medial wall of the pyriform fossa, larynx is involved, and the patient would present with hoarseness. نشوف. This is the pyriform fossa. إذا tumor بالlateral wall عادة يجي على شكل neck mass. Either the neck mass is the direct extension of the tumor or lymph node involvement. Medial wall, it will involve the larynx وخصوصا the cricoarytenoid joint or the muscle, and the patient would present with hoarseness due to unilateral vocal cord paralysis. This is a patient with pyriform fossa carcinoma, and this is the mass of presentation. طبعا hypopharyngeal malignancies are usually diagnosed at a late stage because the sites of tumor growth, خصوصا بالpyriform fossa, the size of the pyriform fossa is very large. So the tumor needs to grow to certain size before it gives rise to presentation, to features, or to produce symptoms I mean. النوع الثاني نسميها post cricoid tumors اللي يصير بالفيميلز، بحين البايرفورم فوسا تكون بالميل كمان. And in this type of tumor there is an association between the tumor and the Plummer-Vinson disease. شنو البلمر-فينسن disease؟ هو نوع من انواع الانيميا يسموها السيدوروبينيك anemia, and the female is presented with dysphagia, with koilonychia and atrophic glossitis. Posterior pharyngeal wall tumors, they are usually found in the midline and exophytic, يعني بشكل mass. 20% of those patients will present with cervical lymph node involvement. In symptoms, dysphagia is the commonest symptom, ومواصفات الديسفيجيا هي progressive, first to solid, then to liquid. ولما يكون to liquid diet معناها there is late stage of disease. Neck mass, either due to lymph node metastasis or tumor mass. Voice change, اللي هو hoarseness of voice or muffled voice in oropharyngeal carcinoma. Referred othalgia weight loss. That clinical examination either by direct laryngoscope اللي هو نخلي mirror مع laryngeal mirror, and we see the tumor mass either in the pyriform fossa, posterior pharyngeal wall, أو نشوفها indirectly in post-cricoid اللي هو pooling of saliva خصوصا بال post-cricoid tumors. We may see vocal cord paralysis or edema of the arytenoid. See here, this is called the pooling sign, saliva. طبعا this is the mass of post-cricoid, or there is pooling of saliva. لأنه the patient cannot swallow the saliva because of the mechanical obstruction created by the tumor. In imaging studies with plain X-ray, we may see that there is widening of the prevertebral space. This is called the prevertebral space, and these are the vertebrae. Normally this space is closed, يعني it's very narrow. لما يصبح الويدث مالته أكثر من body of the cervical vertebra معناها this is يعني due to a pathology affecting this space. فإن tumor نقول there is widening of the prevertebral space. إذا نفس المريض ندز على barium swallow اللي contrast study راح نشوف هذا الفيلنج ديفكت. شوف الداي جاي هالشكل وعابرة من فوق التيومر ونازلة. And this is called shouldering sign. CT scan is helpful to show the extrapharyngeal extension of the tumor like this. هذا pyriform fossa tumor وجاي على شكل neck mass. Endoscopy is helpful to determine the site of growth, extent of tumor, and may facilitate biopsy taking. Treatment, still radiotherapy is the primary stay of treatment, خصوصا بالsmall tumors without neck metastasis or vocal cord paralysis. Surgical treatment, طبعا in large tumors with lymph node or recurrence after irradiation, then total laryngopharyngosophageectomy with the stomach pull-up. And this is one of the major surgical procedures. 1/3 of patients are untreatable from يعني in their primary presentation. طبعا هذا specimen لمريض سوينا له total laryngopharyngosophageectomy. Okay? And thank you.